It's coming.
Good evening, brothers and sisters. My name is Kerry Dahl. I'm the internal organizing coordinator with the Brotherhood of Maintenance of Way. To my right is President Simpson. I'd like to start tonight by apologizing to everybody for our technical difficulties last Tuesday. It turns out that we had scheduled our online town hall for just the moment when Google, which owns YouTube, had some extreme global difficulties. So we apologize for the mayhem that ensued, and we're here tonight. So without further ado, I'd like to thank you for being with us and spending your precious time with us as we grapple with the difficult issues facing both our brotherhood and the working class of this country. So here's President Simpson to take it away.
Good evening, brothers and sisters, and thanks for joining this video conference. It's always a pleasure to address the members and engage with them in a conversation about the nation and the union and bargaining. But tonight we're going to focus on where we are at the national table with bargaining and take some questions and try to answer them the best we can. So the last time we met, I talked to you about optimism and hope and how much work our large committee had put into bargaining this round. We have 16 general chairmen in the United States, 5 vice presidents, myself, and staff on a bargaining committee, and then we have, of course, our healthcare experts that have been engaged heavily in this process. And we had hoped that we had gotten to the point of engagement and investigation and data gathering that we could find the foundation for an agreement. I told you the last time we were live that I was optimistic and thought we had that foundation and was encouraged that we may be able to get to a voluntary agreement. Of course, between then and now, things have changed. The other bargaining coalitions are all in mediation. Today, we were notified by the National Carriers Conference that they were terminating conferences and requesting mediation. So we are now have been told that the carriers reject our proposals and our ideas and the avenues we wanted to try to get to form a fair deal for the members going forward. So the process has now entered the stage and under the authority of the National Mediation Board, I suppose they will intervene since the railroads have asked for that service. And that's where we are. We still have a great case, I think. I think in this process we have the foundation to bargain in a way that hopefully we will maintain our benefits and get a reasonable and respectful wage increase in this process. That's it.
All right. So we have had a cascade of questions come in via email, text, and Facebook over the last week, and we are going to do our best to answer as many of them as possible. We've combined some folks' questions, and so if we don't call your name out necessarily, we just want to thank everybody on the front end for taking part in this and getting us your questions. So some of the questions that have been sent in over the first town hall and then on the run up to last Tuesday had to deal with Amtrak. We're lucky enough today to have the general chairman of the Pennsylvania Federation who leads our charge against Amtrak in negotiations. And so if you bear with me, I'm going to do a little camera work and bring General Chairman Jed Dodd into the picture.
Hello, brothers and sisters.
So Jed, the first question we have comes from Brett Van Vector. He asks, has there been any general movement in bargaining on healthcare with Amtrak?
We are bargaining with Amtrak, and we have a coalition with the Brotherhood of Railway Signalmen, and we've put together an organization called the Passenger Rail Labor Bargaining Coalition. And we've been bargaining for the last couple of years. Amtrak has invoked mediation on us, and we're currently in mediation under the auspices of the National Mediation Board, and they control the pace of bargaining. And with respect to healthcare, Amtrak has some draconian proposals on the table to significantly reduce the healthcare benefits and significantly increase the cost sharing for the members of the union. And so in terms of the question being, has there been any progress? I would say no, because Amtrak is insisting on unacceptable proposals for the members of the union to accept.
Okay, thank you. And then the second question that we've received so far, and if more questions from Amtrak members come in, please send them to me by text or by email tonight, and we'll write them down and get them to Jed to answer. But the second question coming in is, are we bargaining for sick days in this round with Amtrak?
We are bargaining for sick days in this round for Amtrak. Before I talk about the sick days, I'd like to talk a little bit more about the healthcare. We have a health and welfare professional that's assisting us at the bargaining table. It's the same company that is assisting the National Union at their bargaining table. And the difference between the Amtrak bargaining table and the National Union bargaining table is the national freight railroads have provided the information necessary to analyze their healthcare proposals, that we can then make an informed decision about whether or not to address them or make suggestions for different kinds of cost sharing. On Amtrak, they refuse to provide the same information, so we can make an informed decision about their proposals to reduce benefits and increase costs. The National Mediation Board, which supervises these negotiations, is permitting Amtrak to get away with this, and is only scheduling meetings about once every 3 weeks or a month. And so they control the pace of bargaining. They're permitting Amtrak to bargain in bad faith, and we don't see an agreement around healthcare until we're able to get the information we need to analyze their proposals. With respect to sick days, of course we're bargaining for sick days. One of those benefits that we have on Amtrak now are sick benefits. And if you get significantly sick and have to take significant time off the job, with your railroad retirement sickness benefits and the sick benefits we've negotiated under our collective bargaining agreement, you can collect 80% of your salary for almost up to a year. And while this may not seem like something important if you're young and healthy, when you get your first bout of pneumonia, you know, you're going to be very happy that you have these sick benefits and can collect them. Amtrak, the crafts on Amtrak that have sick days do not have the sick benefit. And Amtrak would be very happy to give up the sick benefit in exchange for sick days. And so on the other hand, and so like that's the problem that we have. We're unwilling to give up our sick benefits because they're actually more valuable than sick days. On the other hand, we certainly recognize the problem of men and women that have to work in all kinds of weather. They're going to get sick. And as a result that they do, colds, flus, whatnot, and are unable to work for a day or two, and can't lose the compensation that marking off time that would require. And so what we've attempted to do is redefine the lost time in bargaining for more paid time off, and not necessarily calling them sick days. And so like while we are bargaining for sick days, what we've done is define that as additional vacation days that you can take in single digits, or additional personal leave days, so that you actually don't need to have a doctor's slip to verify that you need to take that time off. And at the same time, you can take those days when you do get sick for 1 or 2 days.
Okay, thank you, Jed. Obviously, that same context is in play at the national table. It's not just Amtrak. We have a lot of questions that have come in from members on the freights who are asking the same question: are we going to be bargaining for sick days? So,
well, the answer is actually basically the same. We have had a sick benefit for our members that's long term and a very good benefit in the event a member is sick, that he has the possibility of taking home a decent payday to keep his family going for up to a year. So the National Division has opted to stay with that benefit. We certainly do not want to change that benefit. And the same answer with regard to time off. We certainly will bargain for sick days, a better way to take vacation days, bereavement leave. All those time off things are on the table, but we will not exchange sick pay for sick days.
Okay, so we're going to jump into the dozens of questions that we received. We've tried to organize them in such a way that it makes sense as we go. The first set of questions is going to have to do with bargaining. And as President Simpson pointed out earlier, there have been developments in our round of negotiations with the carriers today. We've learned that they've moved to mediation. So what is mediation, President Simpson?
Mediation is the services of the National Mediation Board, and it's basically a government agency designed to create peace in the rail labor industry and in the airline industry, and you bargain until some point you have one of the parties decides that bargaining is going nowhere, and they terminate conferences, and they can either ask for the service of the mediation board, or you can just terminate conferences and see what happens. But anyway, today, well, last week, the second bargaining coalition, the engineers, dispatchers, signalmen, UTU, firemen and oilers, I may have missed one or so, that group terminated conferences and invoked mediation services. So we were the only bargaining committee left, and today the railroads decided to invoke mediation on us. So, and what happens with the National Mediation Board, the same thing Jed said about Amtrak. They control the pace of bargaining. They set up the meetings. They certainly, although they're not supposed to try to influence the parties, and have no legal way to influence the parties with regard to their positions, they certainly try to do what the word mediation means, and hopefully stand in the middle. There's some of us that aren't so convinced they stand in the middle with regard to rail labor, but they can hold us hostage, and have recently held one group hostage for 8 years in bargaining, and that was that's pretty damaging to the union way of life, and very hard on the members to understand how anyone can drag the bargaining process out for 8 years. But that was the station in life, and what the mediation board felt their role was, which there's always a debate on whether it is that role or not, but they can certainly control the pace of mediation, and we cannot exercise self-help in this industry until we have been released by the National Mediation Board.
What is self-help?
Self-help is a strike or something like that, job action by the union, or a lockout by the carriers.
So there were a number of questions about the other crafts jumping into mediation. I guess they put a press release out yesterday, and that triggered a number of questions that came in from the membership. Do we feel as though that had any direct impact in terms of what happened today?
It may have had some impact. The recent elections of the Senate and the House and the President of the United States, that may have had some impact. It may have been that the National Carriers Conference just simply want to try to push a little harder than normal to get more money out of our pockets and put it in the pockets of the carriers and the shareholders. I'm not certain, but I'm sure in this industry it's always a crapshoot if the railroads can find someone who has a burning desire to solve a problem and settle an agreement to establish a pattern for the group. I certainly hope that we can find a way that rail labor can work together in a venue that puts someone's best case forward and pushes that case so that we all don't spin a little backwards.
So that speaks to the next set of questions that came in, which had a lot to do with what efforts in terms of solidarity are we seeing amongst the different craft unions?
Of course, our membership is getting younger, but many of you probably were working for the last two bargaining cycles, and we were in coalitions with several other unions, including BLT, in the last two coalitions. We bargained to the end, and round before this one, we were able to set the pattern and move on and get a fair agreement that we thought was good for the members, and it was ratified. The last time we ended up in a president's emergency board with all rail crafts thrown in the same board, and we had a large rail union bargain a deal that I guess for their members or from their perspective may have been a good deal because they ratified it. The problem with their agreement was the philosophy changed, and the way healthcare was delivered was much different than this division's always taken on. We've always, in this little union, been our brother's keeper. We've always said we want to protect our healthcare, and no one should pay more for healthcare than the next member because of making the sick people pay. In our view, and the officers of this union and this division, it's our belief that we are our brother's keeper, that we bargain together, and the cheapest way to get health care delivered to everyone is for everyone to be in the same plan with the same cost. We have no desire to make the sick people pay, and the last round of bargaining, that philosophy was flipped on its head, and a lot of the costs for the health care plan was shifted to the sick and chronically ill, and that's, in my view, not the right way to go. And that's, of course, that's philosophy difference between us and another union, and I'm not being derogatory about another union. I'm just being uplifting and hopefully going to try to convince our members and all rail workers that we need to stay united. We pay enough. The railroads are making enough money to afford this deal without any problem. They will not back up for it. They're proud that they're making enough money to pay for that deal. Simply put, they want to take more out of our pockets because they think they can, and they think that's what the public demands. And I don't buy that line, and I hope in the next coming months that we find a way to bargain together, to stick together, and to insist that we pay no more. We pay enough for health care. We need a decent raise. Everybody you hear in the news, no politician today that you see stand up and talk on public TV, every one of them are in lockstep with America needs a raise, and our members need a large raise, and we need to pay no more for our health care.
All right, so we've gotten into healthcare. A couple of questions have come up, in particular about the national law. So one question was, how did the ACA or Obamacare change our national plan?
Well, it changed to no lifetime caps. Children under the age of 26 were covered on their parents' plan. Annual checkups and minor tax changes.
So let's start with the first one, the no lifetime caps. For some of us who are younger, we might not understand what it means to when you're really ill, that the bills stagger up. So what does that mean, a lifetime cap?
It means that for the life of the member in the plan, the health services that aren't subject to the member paying are capped at a certain level. I think it was 1.5 million before we went to managed care, something like that. Well, I'm getting a little help across the room. Is 1 million cap before going into managed care with no lifetime caps.
So that may sound like a ton of money, but that gets eaten up very quickly if you have any serious kind of condition.
It does. I can give examples, but I'll give one of a member's wife that had a couple of brain aneurysms. Otherwise, a very healthy person, but those two aneurysms and under the lifetime maximum was devastating to that family. And there are other examples of people in managed care with otherwise healthy with brain cancer or brain tumors, that those kind of surgeries and those kind of medical costs run into the millions. And you don't have to be unhealthy and to have a chronic disease of some kind. And that's why the philosophy that we don't want to make the sick people pay. It's all our obligation to take care of one another.
All right, so we've got the Affordable Care Act, the ACA or Obamacare. President-elect Trump has stated, as have many Republicans in Congress, that it's their goal to repeal Obamacare. How would that change the national plan for railroaders?
I don't know that a total repeal would change the national plan to any degree. Just like the ACA, we had to evaluate the plans, and then sometimes by state to see what levels of benefit had to be provided. But I don't see that a repeal of the ACA would be dramatic on our plan. However, look, everyone in this country should think about healthcare and how it's delivered to every citizen. And the ACA, in my view, while I've supported it all along because it was a step I thought in the right direction to single payer somewhere down the road. I don't know how far single payer will we set back now, but there has been some headway toward that process. But this country needs to get in line in lockstep with most of the industrialized countries in this world and find a way to provide a universal benefit to its citizens so that we're not bargaining over the ability to have health care and live healthy in this country. We should be bargaining over the productivity of our labor, not our health care. But anyway, that's where we are today, and it's been that way for some time. But anytime we take a step backwards on finding a way to insure the uninsured in this country and the poor and the sick and the otherwise distressed, it's damaging to all of us if we make it rough on any segment of the society with regard to delivering health care to someone.
Okay. So if more healthcare questions come up, just checking my phone as we go to make sure that we're trying to capture as many questions as coming as possible. I've seen some input about folks having difficulty getting the YouTube link to work. From what I understand, it's working well. So if you're having problems where you are, try getting out of your internet and then rebooting your browser, or possibly even restarting either your computer or your cell phone if you're watching it on your handheld. So we're gonna move back into general questions around bargaining. We've got many of our members have belonged to different unions in the past before they came to the railroad, and in their experiences before they came to the railroad, their union contracts would expire, and there's a sort of a different process. So does our contract expire, and if so, how does that work?
Our contracts do not expire. Contracts under the National Labor Relations Act do expire on day certain, and then you have to do something to extend that deadline, or at the end of the contract, either party is free for self-help. Under the Railway Labor Act, it's a different scenario. It's we can all debate on whether it's good or bad for the employees. I happen to think I've changed my mind a few times in my life, but today I'm convinced the Railway Labor Act is good for the members and rail workers, and it's good for the country and the employers to have stability in the industry as much as possible. The fact that the Mediation Board and others have made a mockery of the system is not indicative of why we should have the law. But in the short answer to that is contracts under the Railway Labor Act do not expire. They're amendable. So your contract goes on forever unless one side or the other serves a notice to amend it.
Okay, good. So now we're going to jump into some more sort of catch-all questions. We've continued to get a number of points of concern and questions around railroad retirement, given the sea change in the politics of our country. We sort of touched on this in our first town hall meeting, but it might make sense to revisit this. Are we expecting any changes to our railroad retirement through the Republican Congress and White House starting next year?
Well, I have been questioning my own sanity lately with some of the comments I've made about things won't happen this way or that way. So I'm certainly cautious about saying no, it's not going to change and nothing's going to happen, because, and that's actually my belief. The railroad's prime plan is solvent. We pay a high tax. The carriers pay a high tax to keep that plan solvent. It's in good shape for many decades to come. I see no reason that anyone would go after the Railroad Retirement Act unless someone has a vendetta against rail unions and rail workers, and they want to pick them out to harm them. And I'd love to think in this country we don't have politicians of any side looking to harm workers. So if no one's looking to harm workers, we should be fine with no issues. Having said that, we don't trust anyone, and we are mindful that when people start talking about retirement plans and benefits for workers, for some reason in this country in the last 2 or 3 decades, I've noticed in my travels and in my interactions with people that folks have gotten to the point they want to talk about someone's high benefits. Maybe they have too many paid days off, too much vacation, too much free time, too much pay. From my perspective and from where I sit, a worker cannot bargain for too much of any of that stuff. And we should all strive, if someone has a few more sick days than we have or a better sick benefit than we have, we should all be striving to accomplish and achieve a higher benefit to that level. We certainly should not be thinking about how we spend some poor workers' benefits back because another worker is not getting the same level of benefit. And I hope that dynamic changes in this country pretty soon, because the labor movement and working people made this country what it is, and if they start to falter, it's going to be sad. But no, we're not making too much money, and we don't have too many paid holidays, and we don't have too much vacation. And I'm proud, damn proud to say that we should all have more, and we're going to fight like hell to get it.
All right, good. So another issue that we hit on in the first town hall that has garnered a lot of interest and a lot of concern is the question of contractors, specifically whether or not it makes sense to try to organize them into our union. And so what sort of comments do you have on that? Starting with does it make sense for us to organize folks who might otherwise be doing our jobs?
Well, these kind of discussions are not new. They've been around this union in particular, this division, for decades since I've been a member. And they're not new to the labor movement. They're not new to anyone. And there are theories around, and in the rail industry, go back to Eugene Debs about industrializing the workforce. In other words, everyone in the industry should be in the same union. Everyone in the same doing the same type work should be organized, hopefully in the same union, but if not, to have density in your industry and lack of competition, or maybe more competition, any way you want to characterize that, then we should be organizing folks in the labor movement because we have good health care and good benefits and good pay, and doesn't mean that we shouldn't strive to have everyone in our community moving toward better pay, better benefits, more time off with their children, the ability to go on a vacation or 2 a year. Those things are good for every worker in this country, not just union workers, and we should be striving to that. Particularly organizing contractors in our industry. That's been a debate in our industry forever. We have fought about it. We've argued about it. We've had convention floor debates about it. It goes both ways. All I can tell you from my perspective, I think we certainly need to organize contractors to do that work. We need to raise their level of pay, their level of benefits, and give them a safe place to work like our members have. And that debate's still going on, by the way. We've not in any big way started organizing contractors outside of people who work for a railroad. But if I had my way, I would certainly try to organize them. And I know that's a heated discussion for a lot of folks.
Okay, so as you've been talking about this, more questions have come in about contracting. Sure. And some of it revolves around the fact that the railroads like to use the excuse that some contracting companies own equipment that the railroads themselves don't own. So is that a valid discussion from the railroads? Is that a valid argument, or should we be fighting back against that?
I'm sure you could find some specialized piece of equipment that the railroad can't purchase or rent, but they're very limited, and most pieces of equipment, in my view and in my long history, can be found and rented for us to operate, or they can be purchased. I don't think it's valid. and the discussion always gets to the competition part, and that's a hard one to have.
Okay, and so I've also just got the question of, will the subject of rampant contracting be discussed in this round of bargaining?
Contracting is discussed in every round of bargaining. How we deal with it I guess it'll be the same way we deal with it most every time. Each one of our system federation has a little bit different setup with regard to scope covered work and how contracting is done on each property. And it's very difficult to settle that issue on a global basis. And so far, we have system federations that have made some monumental gains and some that have made moderate gains. But I can tell you from where I sit, I see system federations every year finding ways to get a little bit of the contracting work back. Are we doing it as quickly as the members would like or hope, or I hope? Probably not, but we're going to continue to work on that. As long as I'm around and as long as we have a union, we'll be fighting that resource that the railroads use.
Okay, so moving on a little bit here, going back to some general bargaining questions. A couple of questions have come in around presidential emergency boards. Do we predict any problems going to a presidential emergency board in this round?
Well, we all know who the president-elect is, and we all know that we get an emergency board, they'll be appointed by a Republican president with a Republican Senate, Republican Congress, and by then probably a couple of Republican members of the mediation board. So it doesn't sound promising. After having said that, we have done okay as long as we prepare our case, do the research, have the data, and we're reasonable and fair. We should do fine. We do okay with Republican emergency boards. But having said that, I may be on here next year, and you may be telling me that I was wrong again.
Okay, so we've had quite a few questions come in around the Brotherhood of Locomotive Engineers. And the question is, we're all Teamsters. How is it that we're not sitting at the same table negotiating?
The last two rounds of bargaining, we had coalitions, and the engineers and BMWED, and along with many others, were in the same coalition. At the beginning of this bargaining round, when we were all ready to serve Section 6 notices, I had a conversation with the engineers and to talk about bargaining coalitions. We both collectively thought, based on our individual particular issues and issues that were going to be coming up, that maybe the operating crafts and the trade crafts and the shop crafts in BMW may have issues different enough that being in the same coalition would not work, and we mutually agreed that that we probably shouldn't enter into this round of bargaining in the same coalition as the operating crafts. So we talk quite often about our issues and where we are with bargaining, and we certainly are supportive of things that other crafts are doing, and we're certainly going to insist on a good deal for BMW based on what our officers' philosophy and our union's philosophy is with regard to bargaining on health care and wages.
Okay. Next up, timeline. What do we expect the National Mediation Board to provide for us in terms of a timeline? And if that doesn't work, how soon would we be into a presidential emergency board? And sort of really what people seem to be wanting to get at is, when is my raise coming? Well,
certainly your raise will come at the end of the bargaining process, when there's either an agreement agreed to and put out for ratification, or one that's imposed and put out for ratification. Well, no, I'm sorry, an emergency board that's put out for ratification. But I cannot predict how quick the mediation services will work with us. I can tell you they've always been rather slow. I can also tell you that in this round of bargaining, BMW has done the research. We're ready to enter serious bargaining and sit down at the table for a month if it takes it, and go through a bargaining process. If we can find a partner that'll do that, and a mediation services that will insist on us bargaining rather than showing up for a day every 2 quarters and shaking hands and going away and coming back in another 2 quarters. The devil's always in the details. The railroads will try their best to find a way to convince another craft and the mediation board that they have a foundation to work towards an agreement. That in my view is probably the worst fear I have, is what other parties would do to establish a pattern for the rest of us, and not that anyone is going to do something untoward regarding BMW members. We have a philosophy about bargaining and how healthcare should be delivered. I don't think any of us will have a problem with trying to find a fair place for wages, but healthcare means a lot to our members, and our members pay enough. They don't need to pay more out of their pocket. We started this round of bargaining with our committee telling the National Carriers Conference we're happy to look at healthcare, turn it upside down, turn the rocks over, and look everywhere we can to try to find a way to control the cost of spiraling out of control healthcare cost. And we have done that. Our division has found a way to save substantial amounts of money if it's applied across the board to all crafts. We have the foundation to settle healthcare in a way that doesn't dramatically go into our members' pockets again, and the railroads get the savings they've said they need. We just can't find a partner that wants to go that route. And it's going to be important that we continue the dialogue on the fact that our members pay enough, and we don't care for the sick people to have to pay more.
So a question did come in from actually one of our frontline communicators in Georgia. Reese Salter was asking the question about mainstream health insurance, and was trying to get at the issue of, given how profitable the railroads are, and given the fact that at the table we've suggested some incredible savings in the plan to them, why this opposition? Like, what's going on here? Well,
our plan doesn't save them enough money. They want to make the sick people pay, the way I see it. And the mainstream part is it's clearly that the railroads they pick a segment of society out in the public sector, and they do averages of what employees have to contribute to a healthcare plan, and then they say we're not in that mainstream group. Well, you know, I don't want to talk about mainstream. Mainstream means nothing to me. It's about dollars, and we found dollars that will save them enough money that they should be happy with our savings and our plan. The only other way around that is either cut benefits or make the sick people pay, and we're not going to do either one of those voluntarily. It's not going to happen. So the railroads are all about mainstream until you look at the mainstream profit that they have, and they have their operating ratios all down to around 60%, or between 60 and 70%. They're paying their stock shareholders tons of money, and they're making tons of money. And if you mainstream them with regard to profitable companies, they're at the top of the heap. I'm glad the railroads are at the top of the heap. They're making tons of money. We need to get our fair share, and our members paying more out of their pocket is not getting a fair share of the deal.
Okay, so staying on health insurance, the question has come up again around the Cadillac tax. So do we expect the Cadillac tax to have any impact on us in the next few years?
The Cadillac tax, my expectation is if anything gets repealed, it'll be that part of it. And we'll have a discussion about what that means to the Affordable Care Act. Look, I'm not an expert on the Affordable Care Act and the things in that plan, but the system is set up that everybody's in. The young people, the married, the single, every person has to have a plan. And when you start chipping away at the foundation of the funding of the plan, then the plan goes away. That's what happens. And the Cadillac tax for us, there's a possibility 4, 5, 10 years down the road, we may get to the level of having to think about paying the Cadillac tax, but the Cadillac tax is, even that is not astronomical, and that's another discussion. It's what is it? Well, it's not nearly close enough to be talked about in my career.
Good. So we don't expect anything coming soon on that.
No.
Another question that came up about health insurance is, does the leadership of the union have different health insurance than the membership?
The bylaws of the BMW has that the leaders or the union officers will have health care equal to the members. We do have, we're not in the same plan as the members, no.
But the health insurance is basically parallel in terms of type of benefit.
Type of benefit, yes.
Okay, good. All right, so going back to a general negotiation question, do we expect to be getting back pay at the end of this bargaining round, given that we expect the bargaining round to go on for some time at this juncture?
I expect to get back pay. I'm not a fan of lump sums or bonuses.
Why not? What's wrong with bonuses?
Bonuses and lump sums, you don't get the escalator effect of compounding. And I want something that goes in your paycheck that a nickel turns into 2 nickels in 4 or 5 years. Good.
So, Freddie, you've been around for a little while. You guys took some bonuses way back when you were a young railroad worker. What did that mean in terms of what ended up being your pay 20 years down the line from that bonus?
Well, if the bonus would have been actual pay increases, the compounding effect would have been substantially more than what we make today.
And so when we're talking about compounding effect, we're talking about working at overtime rate, we're talking about vacation pay, all of those good things.
And I'm not demagoguing or derogatory about someone selling a contract for a bonus. We settle based on the circumstances today and how that deal is being played out, and look, there's a way to get to an agreement if it's fair and the members ratify it. This division will not put an agreement out that we don't think is fair, and I'm not inclined to think. Well, I can tell you from where I sit, I don't think there's a national division officer that would support me suggesting that we get anything but pay increases. Bonuses not included. There are no reasons for us to do that.
Okay, so we got a more general question about the politics of the country from Bill Kendrick, who asks, with the wave of anti-union sentiment in the United States through right to work and the rise of the Republican Party, is it possible that the major unions in this country will honor and work with each other to fight for each other? Well,
just between me and you, there's no option here. We are down in the labor movement 10, 11, somewhere around that percent of workers in this country belong to a union or an organization or an association of some kind that collectively bargains. And if those numbers keep dwindling, well, we can all do the math. It's devastating, but union leaders have no choice today but to band together and fight for the same good things they've always fought for. And by the way, I don't know that union leaders haven't always tried to band together, but it's certainly a serious time today with the way the sentiment is in the country and the way the politics are going.
Okay, so I just got a question from Matt Burdett, who I believe is also in the Penn Fed from Pennsylvania. He asked a question about, has the union thought about self-insurance for the membership or trying to create its own insurance policy free of the carriers?
This division, this round, has looked under every rock we could find. We have looked at self-insurance. We've looked at the possibilities of that. There are possibilities for going down that path, but it's a pretty steep cliff to jump, and you better hope you got a parachute when you go. And it's the cost of some of these, the cost of healthcare and the way it's delivered is unpredictable, and it'd be another job for people who aren't skilled in that arena to run a healthcare plan for the members. Not that we couldn't get there. We have talked about it, and yes, we have looked at it. And today, I think the officers have come to the conclusion today is not the day to do that. But we will always visit that place and look to see what self-insurance would do. We always wrestle with, what if you take a lump sum of money for healthcare and just give it to members, how they will spend it. And we haven't gotten to the place where we're comfortable enough to say we want to go down that route. Okay, and then bouncing back to the back pay question, and then we're going to move on to some more localized issues. Zach White asks, why is back pay just a straight time thing? Why doesn't it apply to overtime? Back pay always, overtime is considered. Okay, so Zach, we'll, if you have more questions on that, please reach out to me and we'll make sure that we hook you up with your general chairman or your vice chairman. So that's a good segue into for this town hall, we received dozens of questions that were not necessarily in line with the theme of what we're doing with these town halls. So we're trying to keep this discussion limited to what's happening at the national bargaining table. The large issue that we're all facing, obviously, is healthcare. And until we're able to grapple with the healthcare issue, the more localized issues that you're all facing directly with your railroads are going to be difficult to get resolution over. So that being said, we did get a bunch of questions about a handful of the same issues, and we sort of want to walk down what those were. So I'll just raise them and we'll go from there. So something that we got from virtually members on all of the railroads were questions about jobs being taken down and furloughs coming. And so if folks have those kinds of questions, who should they reach out to? Well, first, maybe they could just go to their local lodge officer, the local chairman, or someone. I hope that if all of you do not have an agreement with regard to your specific property or work area, that you would certainly try to get your hands on one and take the time to read them. They all have an index about these subjects, bulleting jobs, assigning jobs, layoffs, layoff notices. All those rules are in the agreement. I first hope you would go find one of those agreements and read it. And then if you don't, can't answer the question in your own mind, or you're confused about it, then certainly you can always send me a letter or a note to National Vision. We will get it to the proper general chairman to answer your question, or go to your general chairman or vice chairman and just ask them the question. But I'm not dodging a question. I'm trying to tell you, we will, in the next coming years, we will need the engagement of the members and the folks on this phone call or whatever we call this thing. I'm kind of old, so it may be something I don't know about, a town hall meeting. But we certainly need every member to get engaged and at least take the time. If you don't have an agreement, call me. I'll find a way to get you one, and read that agreement. Think about what's in it. Think about how it got developed, how many years and decades that people put into putting these agreements together and protecting the benefits that are in them. I've heard folks all over this country say, well, my agreement's lousy. Well, there's no such thing as a lousy agreement. An agreement is something that someone probably died over somewhere in history, and you have the benefit of those agreement rules today. Now, there are certainly some agreements that may be a little less luxurious than others, but in the main, all our maintenance away agreements are good agreements. They have most every subject's covered that you'd want to be covered at the workplace: seniority, vacation, bereavement leave, holidays. All that stuff is in there in some form or other. So I encourage all of you to take the time to get yourself an agreement, read it, study it, and please engage in this union in a way that we have your support, as well as we believe in the members and this union and how we move forward. Because if we all don't take that on as individuals and learn how to work collectively together, those benefits will not be there forever. They'll probably certainly be there in my lifetime and to the end of my career. But I hope that I leave behind me a stable membership with officers and members that are united in a way that they can continue this union for another 130 years.
Okay, so we have just a few more minutes to go here. You mentioned lodge, getting involved in lodges, reaching out to your lodge if you have questions about jobs being taken down. We got a question from Randall Mayon asking, what can we do to get the younger members of our brotherhood involved in lodge meetings?
Well, Randall, I hope you answer that question for me, because you see this old fool on this screen, and we're trying to engage the members in a way that means something to them. That's why we started the CAP program. That's why we started the educational programs, to try to engage in a way that we understood younger members. I was actually at one time in my life, I was a young guy. And I probably had some of the same questions you did, and experiences has got me to where I am today. So I don't know the answer to that, is what I'm trying to tell you. We talk every time we get together, how do we increase participation at the local level? And the conversation ranges from, well, they have it so good they don't care to come to a local lodge meeting or come to a meeting or get on a town hall meeting and engage with the union. They've got it too good. Well, I don't think you've got it too good. I understand how hard work is out there, and I actually worked out there at one time in my life, and I know the trials and tribulations you go through trying to balance a life. Many of you on the road 6-7 days a week, 9-10 days and then off for a few and then back to work. I understand all of those, and I sympathize with all those. But the key to it is we have got to be our brother's keeper. And once we all adapt that and force ourselves to engage in this union or in your community or in your church or whatever you do in life, if you leave it to someone else to always do, then you have to suffer if they make a mistake. So I encourage you all to take some ownership in this union, take control of it, and force me to do the things you want to do.
While President Simpson was just giving that answer, a vice chairman from Montana, Sean Elstad, mentioned that we can find all of the agreements under which we work online on our Federation website. So if you have a hard time finding your agreements, feel free to contact me, and I will email you a link, as well as the contact information for your vice chairman.
The BMWE has most of the links for the federations and even the local lodges that have web pages on the single website. I mean, you can go there and find many links to your federation.
So some of the other issues that were more localized issues that we encourage you contact your vice chairperson or general chairman on had to do with per diem. Particularly, we heard this from BNSF members, but also travel reimbursement on Union Pacific. Those are questions that you should be reaching out to your system officers, your federation officers on. We will be doing more of these town halls. Our intention is to keep them focused on issues of national bargaining. If issues around Amtrak bargaining come up, we will take those and involve General Chairman Dodd, who we were very grateful to have with us this evening. The last question that has come through has to do with right to work, which is on the march. Some people call it right to work for less. The question that's come through from Mark Lecker is, if I live in a right to work state that just went right to work, what does that mean for me as a railroad worker?
As a railroad worker today, it doesn't mean much other than you're in a community where you need to help your community and help your state to try to grow and move the collective bargaining process and union labor. Today, we're fortunately not covered by many state laws as railroad workers. That can be, in this case, it's a positive. In some cases, federal laws can be a negative, because I think sometimes our members feel removed from the federal process, and there's so much negativity in all these states about federal agencies and federal law and federal intervention that our members see the news as well, and they get entangled with that derogatory movement against federal agencies. But I can tell you firsthand that railroad workers have a pretty good deal with the federal agencies, even with sometimes feeling like these agencies aren't actually acting in a way that they should in helping and assisting the workers in this country. But even having said that, the federal laws mean a lot to us. From the time you strap your shoes on in the morning to the time you take them off at night, as long as you're on the job, you're covered by some federal act, and it's important who the president is. It's important who his cabinet is, and it's important who runs the agencies that oversee railroad workers and airline workers. So I hope you engage yourself there as well and think about all that stuff because it's vitally important that we protect what even people before me fought and died for in this country. It's getting pretty dismal with regard to the labor community.
Okay, so I'm going to give the floor to Brother Dodd for some last parting comments. See if I can do this without toppling the entire computer.
We're going to, on January 20th, Donald Trump is going to be inaugurated into the presidency, and we're going to be in uncharted waters. A right-wing Republican government is going to control the Congress, the House, the Senate, and the White House, eventually the Supreme Court. And we don't know what that's going to mean for us specifically, but we do know it's going to require a unity that we've not experienced before in order to stand up to this situation. And it's going to require new experiences, new solidarity, and new sacrifices on every member, every officer of the union in order to make sure that we come out of this period unscathed. Thank you.
Thank you, Brother Dodd. And last words from Brother Simpson.
The last thing we'd like to talk about, and I know it's been a long, lengthy discussion here, but we have a BMW health and safety survey out there that's vitally important to the future of this union and its members and the safety and the places they work and the surroundings they work in. Years ago, well, my entire career, we've talked about clusters of illness and occupational disease on the railroad. You know, we run across 2 or 3 guys that have had some kind of the same kidney cancer or some other form of stomach cancer or esophagus cancer or something or some bodily problem that seems to be associated with exposure to their workplace. And all of us think that is the case. The problem with that is for all those decades, we've all thought that, but no one has ever tried to put together the data to prove that. This union, through your officers and believing in the members and the fact that they would unite and help us get the answers to those questions, embarked on a tough project of a survey of the membership and the retirees that we could get to respond on the survey to try to get data that would lead to conclusions regarding those questions. Now, it may be that the data we get leads us to, well, there's no dangerous chemicals or no dangerous things in the workplace. Vibration doesn't hurt your body, and all those workplace issues don't wear on your body. But the problem is we're having a low turnout with these surveys. It's vitally important. I know they take 30, 40 minutes to do, and I know it's online, but if you can find the time to do it yourself, get a couple of brothers or sisters that you know to do it. We're in needs of as many of these surveys completed as we can get, and we have extended the deadline to get them back once or twice already. And it's just so important to the future workers in the maintenance of aircraft. Please, I beg you to take those surveys because it's not about the money. The members the officers have put their trust in you to answer these survey questions, and they've authorized the spending of a good chunk of the members' money to get this done. And the worst thing that we don't want to happen here is we don't get enough response to make the survey valid, because it needs to be done. I don't see it, the ability to do it again in well, it won't be done in my lifetime. So we've put a lot of work, a lot of folks have put a lot of effort into this, and I know it's time consuming, but it's only 40 minutes out of a long career if you can find the time to get online and do it. If you don't want to do it online, you'll get prompted with a phone number. Call the number, they'll send you a survey in the mail. If you don't want to do it that way, call the number, and there are ladies there that will ask you the questions online if that has to be done that way. The simple fact is we have 30,000 members. It would be awfully hard to have them call and every one of them do it on the phone with somebody writing the answers down. But we want the surveys done, and please get them done. That would be a nice New Year's gift for me to say we've got 15 or 20% of our members to respond.
All right, so thank you very much for hanging in there with us. The hour is up. We appreciate your joining in and sending in your questions. We hope we were able to get some good information to you tonight. If your question was not directly answered, please follow through with me, and we will make sure to get you an answer. In all likelihood, we'll be doing this again shortly into the new year, so stay tuned. As President Simpson pointed out earlier in the broadcast, we are not going to just embrace the carriers and take concessions on healthcare. We're going to be putting up a fight. So stay tuned. The communication action team organizing will continue, and we're wishing you and your families happy holidays. So thank you for your time, and take good care. Thank you.